Hi, my name is Teresa Hernandez. I'm here with my patient doing a neurological check. I'm going to be getting my patient's consent. I'm with United States University, and I'm doing this video for my professor and for other classmates to review. Can I get your name and date of birth?
Tomas 7/13/90.
Okay, and do you consent doing the neurological examination to be uploaded to YouTube for educational purposes?
Yes.
Okay, so I'm gonna go ahead and start with washing my hands with my sanitizer. And I already asked him his name. He is alert. He is following command as far as I asked him why he's here. So what brings you in today?
Just a general checkup.
And where are we at?
In Las Vegas.
Okay. And about what time is it?
6.
Okay. And the event that we're doing right now is what?
Checkup?
Okay. And so he's alert and oriented times 4. He was able to give clear speech. He is easy to understand. What did you have for breakfast this morning?
Omelet.
Okay, so he remembers what he had something recurring that just happened today. And then, do you remember what year you graduated high school?
2009.
Okay, and so for reasoning, I would ask my patient, for example, let's say if you found a wallet on the ground with money, what would you do?
Trinity.
Okay, so he has good judgment. So I'm going to go ahead and start with the cranial nerve 1, which is the olfactory. I'm checking with the smell. So I'm going to have my patient close his eyes, and I'm going to also ask him what he is smelling. So close your eyes and press one nostril. Sorry. Okay, I'm going to ask you if you smell. What you smell?
Alcohol.
Okay. And can you do the same thing with the other nostril? What do you smell?
Coffee.
Okay, so his cranial nerve 1 is intact. So I'm going to go and move forward to cranial nerve 2, which is the optic. And for this exam, I'm going to use my Snellen chart. So with this Snellen chart, it requires to be 6 feet apart from the patient. So if I can just have you spread your arm towards me, and this is about 6 feet. With both eyes, can you read the last
LTFPH.
Okay, and then cover your right eye.
LTFPH.
And cover your left eye.
LTFPH.
Okay, so he has a vision of 20/20, so that is good as well. And then I'm gonna also be checking his peripheral vision with this. I'm gonna ask him when he sees my fingers. So tell me when you start seeing my fingers. Okay. Okay. So for his peripheral vision is intact as well. And also with my pen light, I'm gonna ask him to focus on it, and I'm gonna move it closer and far away from him. So if I can have you close. Okay, so that is intact as well. So I'm gonna be checking his eye. With my and you can see that I'm turning on my light. It's on my palm, and so with this, I'm going to be checking his retinol, his ophthalmic disc, his cup ratio, and his vessels, and his eye. So with my right hand, I'm going to hold it, and then I'm going to check his right eye. Okay. So I did see the red reflex as well, and I see the vessels and the margin of the atomic disc, and also the cup ratio was 2/4. I'm gonna do the same thing in the other eye. Okay. And the cup ratio was 2/4 as well. And I did note the vessels, and I did note the atomic disc and the retina as well. Everything seems about normal. I'm gonna go ahead and start checking for his cranial nerve 3, which is the oculomotor. And also when I'm checking the cranial nerve 3, I'm gonna be checking cranial nerve 4, which is the tracheal cranium, and then cranial nerve 6, which is the Dusens. So with this examination, I'm going to be checking his, doing the cranial or cardinals and six cardinals of Glades. I'm going to have him follow the object and check those cranial nerves. Okay, so cranial nerve 3, 4, and 6 intact. I did not note any nystagmus. So I'm gonna go ahead and move forward to cranial nerve 5, which is the trigeminal, and I'm gonna be checking it with sharpened dull. So I'm gonna have you close your eyes and let me know if you feel sharp or dull or soft. Okay, so cranial nerve 5 is intact. And also I'm gonna have him, I'm gonna check his cheeks. So I'm gonna have you blow, your cheeks, and then press your tongue. Okay, okay. So he has good strength, no resistance, and then try to open your jaw against mine. Perfect. And no resistance as well. So I'm gonna be checking cranial nerve 7, which can I have you lift your eyebrows up? Okay, so that movement is intact, and puff your lips, smile, and make a frown. Okay, so cranial nerve 7 is intact as well. I'm gonna be checking cranial nerve 8, which is the acoustics, and by doing this, I'm going to be having the patient cover one ear, and I'm going to whisper a word, and he's going to correctly say the word I whispered. And cover the other ear.
Baseball.
And he correctly said the words that I whispered in his ear, which is apple and baseball. And I'm going to do the Weber's test as well with my tuning fork. Tell me if you hear the vibration or the sound in both ears, one ear, or none, okay? Okay. So he has a good positive test on that one, and I'm gonna also check the I'm gonna do the Reinen test, which this is gonna be for the air and bone conduction. So on the bone, I'm gonna put it on the mystoid, bone,
Stop.
air,
Stop.
okay, and do the same on the left. Bone, air.
Stop.
Okay, thank you. So that test is intact as well. So now I'm going to be also checking his cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagus. And with this test, I'm going to just use light, and also a tongue depressor. And I'm gonna have the patient say the word ah, and I'm gonna be checking his gag and swallowing reflex as well. So can I have you say ah? Okay, I see his tonsils as well, so +2. And I didn't see any lesions or anything like that. Are you able to swallow with any problem?
No problem.
Okay, and his gag reflex was intact as well. For assessors, cranial nerve 11, which is the accessory, I'm gonna have the patient shrug his shoulders. Okay, so the cranial nerve 11 is intact. And then also cranial nerve 12, which is the hypoglycemia. I'm gonna have him move his tongue, or stick his tongue out, move it side to side, middle, up and down. Good. So he has, and against the cheek again. Good, good. So he has a good strength in cranial nerve 12. So I'm gonna do the cerebellum test. So what I'm gonna have you do is stand up and walk towards me. Okay?
Just walk?
Yes, so just walk towards me. We're just checking your gait. Perfect. And it's steady, no swerving or drifting to the side. So I'm gonna do the tandem test. So this is walk towards me again, heels to toes, with your arms. Yeah. Okay, perfect. And then another test that we can do is to check his walk is walk on heels. Perfect. And then can you walk on your toes? Okay, perfect. So go ahead and take your seat again. Oh, I'm sorry, we're doing the wrong step. So just stand there for me. Just stand right here. And keep your feet together. And your hands spread up. Close your eyes. And right here I'm checking for any drifting. I don't know any drifting. So now go ahead and take a seat. So we're going to do the rapid alternative movement. So can I have you touch nose, touch it, and then alternate? And that is intact as well. So now I'm going to go ahead and move over to the sensories. With objects, I'm going to ask my patient to close your eyes. And I'm going to be checking for different sensations, okay? So first, tell me if you feel me touching with 2 points or 1 point. If you should feel a little sharp, if you feel sharp in 2 points or in 1 point, okay? Okay.
2.
Okay, so that sensory is intact. And I'm gonna also have you, let me borrow your hand and close your eyes again. I'm checking the graphophagia sensory. So tell me what I draw in your hand.
A 3.
Okay, correct. So that is correct as well. And I'm gonna also be checking, so continue with your eyes closed for me. I'm gonna be checking to see if you can either feel soft or a prick. So let me know if you feel soft or prick. Okay?
Soft.
Okay?
Hook.
Okay? And
Soft. Hook.
okay, so he correctly said the correct sensory on the upper extremity, so I'm gonna do the same on the lower extremity. So keep your eyes closed.
Prick. Soft. Soft. Prick.
Okay, so he has good sensory, sorry, on his lower extremities as well. So I'm gonna also be checking his, can I have you lay back a little bit? For any neuropathy at this point, I'm gonna ask the patient if he feels the tuning fork vibration on his toes. You feel it?
Big toe.
Okay.
Big toe.
Okay.
Big toe.
Um,
Top of my foot.
okay. So he was able to feel sensation in those areas, and then also in
My ankle bone.
okay. Until he's able to feel sensation on the toes, the top of the foot, and behind the ankle. Now I'm gonna go ahead and check his motor system. Can I have you sit back down? Sorry, I'll help you up. So I'm gonna check his deltoid. What I'm gonna put some pressure on you, and you just go against the resistance and shrug your shoulders. There you go, perfect. And he has good muscle tone for the deltoid, and also for his triceps. I'm gonna also pose with the tricep. Oh yeah, push against me. Thank you. And for the tricep, so the biceps, I'm gonna have you push against. You go towards you, and I go against you. Perfect. So he has some great motor muscle on the upper extremities. So also can I have you grip my hand? Okay, he has a good grip on the right and a good grip on the left as well. So now I'm gonna have you, we're gonna check your quads, okay? So you press against me or towards me, thank you. Okay, so he has good muscle tone on his legs as well. For his hamstrings, I'm gonna have him laying face down. And you push up, and I will push against your strength, okay? Go ahead, good job. And again, good job. So for this, I can also check his hips. So can I have you turn around for me?
Back.
Yeah, bring it back. I'm gonna check his hips, which doing abduction and abduction. So lay your legs straight for me. And abduction, adduction, adduction, adduction. So good. Any pain, any tenderness in any other joints? No. Okay, great. So he doesn't have any problems on the upper. So I'm gonna also check his deep tendon reflex as well. And first, have you come up again? Sit up at the edge of the band. So I'm gonna be checking the biceps first, which is right in here. And okay, perfect. And the brachioradial. Okay. And then the triceps as well. Okay, great. Great reflex on the upper extremities. So I'm gonna be checking the patellar as well, and which is in the knee. Okay. Okay. And we'll check this bilateral. Okay. And okay. And just rest your hand on me. Okay, good job. And the patellar as well, I checked it bilaterally as well. And the Achilles, I'm gonna be checking. Good job. And the Achilles were positive as well. I got a positive reaction. And sorry, one more time on the laying down. I'm gonna be checking doing the Binsky's test, which I'm gonna look for curling of the toes. Okay, so he has good sensation on the sole of the feet. Other than that, we are done with the neural assessment. And do you have any questions for this exam?
That was fun.
Okay. Well, that concludes my assessment. Thank you for watching and have a good day.